everyone, where US is now expected to deny visas to people with diabetes, heart diseases and other chronic illnesses. Foreign nationals seeking to immigrate to the US could now be denied visas and green cards based on pre-existing chronic health conditions such as diabetes and heart diseases under the new guidance issued by the Trump administration. Now, this directive, which significantly expands the criteria, who is deemed to be a potential public charge, has now been sent by the State Department on the U.S. Embassy's consular offices worldwide, and a cable that has been sent by the State Department to visa officers instructs them to flag applicants whose medical conditions could require hundreds of thousands of dollars worth of care. And this list of conditions cited included, but it is not limited to, cardiovascular diseases like respiratory diseases, cancers, diabetes, metabolic diseases, neurological disorders, and even mental health conditions. Let's connect again with Srinjoy on this. Srinjoy, the U.S. adding these new grounds to deny visas. I mean, even if we speak of US and the healthcare system, and most of the people, how they have themselves been suffering from obesity and diabetes, they seems to be now applying this very ground to not allow people with such diseases to enter the United States while the screening process is on.
Yes, this will principally be for people who are applying for green cards. That is what it's mostly for, because they believe that this will affect or impact on the health system. That is the new American view. Of course, we know obesity levels in America are particularly high, coming from eating junk food and all that. But now the American government believes that if you have diabetes, if you have heart disease, if you have the other disease you spoke of, neurological problems and so on, then you shouldn't get a green card. Now, this will naturally impact on people who are trying for green cards a significant number, a significant percentage. Even if it's a small one, like 5%, it will lead to a significant number of people will not be eligible for green cards anymore.
All right. So the new guidelines adds new medical conditions now to be considered, and visa officers have also been instructed to assess if applicants are capable of paying for their medical treatment. Thank you very much, Srinjoy, for joining us here this morning with those international updates we are tracking. Let's in the meantime move on and